warning more big increases from the health department as more people are being hospitalized with COVID-19 now than ever before.
You can see it right here. In the past 24 hours, more than 2,400 new cases have been confirmed, bringing the total to more than 84,000. That includes 109 new hospitalizations. That's the highest one-day total so far. Our hospital capacity is dipping a bit along with the surge in new cases. Right now, 19% of hospital beds are available. As for ICU beds, there are 331 left statewide, a total of 16%. The acceptable rate for both is 25%. We do have some good news. We have 67% of the state's ventilators still available. And you know, at this point in the pandemic, sometimes it is easy to forget that all the COVID numbers represent people. In some cases, our family, friends, and neighbors.
But inside the Mid-State's COVID intensive care units, doctors and nurses are personally witnessing the grim reality of the increasing number of patients now being hospitalized.
News Channel 5 Chief Investigative Reporter Phil Williams has been talking to the healthcare professionals working inside one of those ICUs.
We have almost an entire floor filled with COVID patients.
Here inside Nashville Skyline Medical Center, the battle against COVID-19 still rages.
We have an entire intensive care unit set aside for COVID patients, which remains full.
Dr. Murray Ahrens heads Skyline's critical care department. He says the fact that not everyone who gets COVID-19 ends up in the hospital actually makes the virus all the more insidious.
What makes this disease so deadly is that huge numbers of people can get it, not be that sick, and act as spreaders throughout the community and vectors to transmit this disease to a large portion of vulnerable patients.
And those patients, the relatives of those who feel invincible, are the ones who sometimes end up here fighting for their lives.
We had several admissions over the weekend of people who had family members who went to Florida for a beach vacation and, brought back, memories and COVID-19 and gave it to some of their family members, and some of them will die.
We are having more patients in the hospital, but they're also a lot sicker than what we've seen. So their length of stay is longer, it's more intense.
Nurse Carrie Bean says if the deniers could experience what she sees here in the COVID ICU, they might not be so quick to cast doubt about the reality of the crisis.
We have a lot of patients who are in their 20s and 30s. This disease, this virus definitely does not discriminate. It's not just for the elderly. And we've even seen patients who have no real health history, no real complications, or come in and get sick with the virus as well.
One of the most difficult parts of the job, watching patients suffer alone, sometimes dying alone.
As a nurse, it's hard to see people so isolated. I think when people come in and they're sick and family can't be with them like they normally would, be there to support them, it's hard to see patients going through these tough times alone.
Have you ever seen anything like this?
No, I have not. Nothing even close. Not the flu seasons, no.
I had one fellow who started out as someone before he got sick who really didn't believe in this, thought the whole thing was a hoax. Relatively young, strong man in his early 50s, thought this thing wasn't real, and he almost died. And
Dr. Ahrens said treatments like the drug remdesivir and convalescent plasma therapy are helping save more lives, but
a large portion who get critically ill, it tends to be an inexorable, endless progression towards death in many of these patients, even when they get all of these treatments up front fairly early. It is the worst infectious process I've seen in my 25 years of practicing medicine.
While the doctor fights to save lives ravaged by the coronavirus, he wishes more of the community would join the battle.
At some point, it just starts to feel like it's insanity. I mean, our best defense is prevention, and simple things like wearing masks to just help each other out and just act sensibly. And we just can't seem to get a large percent of the population to do these things.
Phil Williams, News Channel 5 Investigates.
Thanks, Phil. Across the mid-state, some hospitals are now having trouble finding enough doctors and nurses to staff the beds they have because more of them are also being diagnosed with COVID-19.